So welcome and thank you for being on time. We're going to go back and forth between the slideshow and having the opportunity to see each other's faces. We're expecting about 20 people today, and so I'm sure people will trickle in as we continue with this training. We'll be together for about 3 hours today, and we'll have one 15-minute break. But I encourage you to listen to your body and take care of yourself as we go through today. Here's a little introduction to the Mindful Birthing and Parenting Foundation. I'll introduce myself and talk more about the intentions for today as we go. But I also want to acknowledge Dawn, who is on this slide in the bottom right and is also on screen now. Dawn is our backbone of our teacher training. This day wouldn't have happened without her, and you'll get to know her very well if you don't know her already, if you continue on with our teacher training. She'll also come back on at the end of today to answer any questions or to help people with applications, registration, etc. So thank you, Dawn. So my name is Jen Moffitt. I work at the Family Health Center of Worcester as a nurse midwife and an MBCP teacher, in addition to my work for Mindful Birthing and Parenting Foundation and teacher training. And that quote, "I need this in my life," was said by the person right above the quote, who's sitting out on the porch with her baby, when she opened her eyes after her first mindfulness meditation in a centering pregnancy group. I'm going to do a quick but significant land acknowledgement about the land where I work, Worcester. I want to acknowledge that Family Health Center is located on the land of the Nipmuc and Agawam peoples, and recognize that the repeated violations of sovereignty, territory, and water perpetrated by invaders that have impacted Nipmuc and Agawam people for the last 400 years and into the present. I extend my respect to citizens of these nations who live here today, their ancestors who have lived here for over 500 generations, and to all Indigenous people. I also affirm that this acknowledgement is insufficient and doesn't undo the harm that has been done and continues to be perpetrated now against Indigenous people and their land, water, and air. And here are some family photos from my family. So I've been practicing mindfulness since I met Nancy Bardicke in 2003 as a midwifery student. And until that point, I was 1000% type A perfectionist. And I've been undoing that since I started practicing back in 2003. And now I'd love to hear who's in the room. So if you would be willing to type into the chat where you're zooming in from, and if you'd like, one thing that has changed in your life recently. This is something that we often ask of our MBCP, Mindfulness-Based Childbirth and Parenting participants on their first day of MBCP, is to speak one thing that's changed in their life recently. When you're pregnant, often your life is constantly changing. But if you're paying attention, even when you're not pregnant, this can be true. So if you'd be willing to just type in where you're zooming in from and one thing that's changed in your life recently. It could be very big or very small. That would be great. Jessica, your daughter started first grade. Thank you. Glad you're here. Carly, welcome. Great to see your face. Oh, hi, Raya, and congratulations. Welcome. Hi, Marjorie. Oh boy. Schooling plans changing last minute. Yes, interesting is an interesting word for that. Sending strength. Happy that you're here, Rachel. Oh, and actually, I think I read two, I combined 2 and 1 because of the way they came through. So that was Rachel and Marjorie. Oh my goodness, I relate to Marjorie's. It's such a big success for your dog. Congratulations. Am I pronouncing your name right, Gina? Who's parenting a middle schooler? Like China. Perfect. Thank you, China. And parenting a middle schooler also takes strength. Welcome. So glad you're here. So if people want to come on screen, of course, you're welcome to do that. Often that can help create community. We will be looking at slides for much of the time today, and you're also welcome to stay off screen the whole time too, whatever makes you feel most comfortable. Hi, Jessica. Hi, Marjorie. All right, so our intentions for today, but reviewing what mindfulness is, looking at some of the research around the impact of stress on outcomes, introducing you to MBCP and the research about MBCP, and primarily if you're experiencing stress and or change in your life, even good stress is still stress. You will have an opportunity today during the next few hours together to practice mindfulness over and over. We'll be doing multiple mindfulness practices and reflecting on what you noticed during those practices. So as you look at these intentions for today, if you have an intention for this session, something you really were hoping to get out of the next 3 hours, I would love for you to share that with us in the chat, what you're hoping to learn or be able to experience in the next few hours. Please feel free to write that in the chat too. I want to give you a taste today of what it's like to be in an MBCP classroom. And one of the blessings of being an MBCP teacher is that your homework, when you're in your teacher training and beyond, is to practice mindfulness. Great. We'll definitely cover that, Raya and Rachel. Thrilled that you're both here. Fantastic, Marjorie. You came to the right place. Yeah, Jessica, thank you. And for people who are here today who have been through the teacher training before, as we go through today, if I'm talking about the teacher training and you feel like I left something out or there's more to be said, we have a lot of experts in the room today. And people who haven't gone through the teacher training, you are an expert in your own life, and I really want to hear your input and feedback as we go through today. So welcome. And before we move on, I think it's important for us to make sure we're on the same page in terms of a shared definition of mindfulness. So here's one of the most famous ones. is that mindfulness is the awareness that arises from paying attention on purpose in the present moment and non-judgmentally. After I said I wasn't going to read any slides to you, there it is. So let's just break this down for a minute. Paying attention is sort of the opposite of being on autopilot. So we might know what autopilot feels like. We drive somewhere, and when we get there, we realize we weren't even there on our way there. We were focusing on something else while we were driving. We can tell when we go to a medical appointment, for example, if our provider is tuned into us or if their minds are on the last patient or on needing to go home. We can often feel that. On purpose, that is really about making a choice. And as we're practicing today, you'll notice that in my guidance, I am offering a choice again and again to come back to this moment. Most people, about 60% of the time, our minds are either in the past or in the future. And a lot of that can be really helpful, really instructive. You wouldn't have gotten here today if your mind wasn't in the future planning, getting yourself here. You made it. And sometimes thoughts about the past can take the form of rumination about that moment last week or 10 years ago or whenever. And sometimes thoughts about the future can take the form of what if this happens? What if this happens? Anxiety. And so sometimes it can be helpful to be able to notice where your mind is and then make the choice. I'm going to come back to this moment, to this breath, because the breath and the body are always in this moment. The breath and the body can't be in the past or in the future. And this non-judgmentally word is really just about noticing judgment. Our minds are judging all the time. I'm sure your minds have already formed a few judgments today since you arrived here. I didn't think it would be like this. Oh, this will be relaxing, whatever. So non-judgmentally is a little bit of a misnomer, but it's mostly just noticing the judgment that's there and not necessarily choosing to believe it. Again, we judge all the time. Right now in this country, and actually for a while now, we've been in kind of a mindfulness revolution. So some of us are even feel like the word mindfulness is a bit overused at this point. You can see it everywhere, and everyone's encouraging mindful this, mindful that. There's a phrase now called McMindfulness, which is kind of like making mindfulness a consumer type thing. And so just being aware that everything that is being marketed is not necessarily mindfulness. And we have to be really careful when we're teaching to be really saying exactly what we mean. Mindfulness meditation can change the structure and function of the brain, but just like exercising, you have to actually do it for the brain structure and function to be changed. So just like you don't get muscles by reading about exercise, your brain doesn't change just by reading or thinking about mindfulness meditation. It's practice that makes the difference. So we're going to take a minute now just to practice some awareness of breathing. And so if you feel comfortable, you can feel free to close your eyes for this practice, but you don't have to. You can also just allow your eyes to rest on the floor a few feet in front of you, bringing yourself to a position that embodies wakefulness. So we're waking up to this moment. You can practice mindfulness in any position, laying down, standing, sitting. But for right now, you might just bring some curiosity to what happens when you have your feet on the floor. You're aware of the contact between your body and your chair or bed. You allow the spine to rise gently from the lower back. Take a moment to check in with the shoulders, allowing them to drop away from the ears. And tucking the chin ever so slightly so that the back of the neck is long. Just allowing yourself to come into a mode of being. Just being right here with this body, with this breath. Taking a break from our usual mode, our mode of constant doing. Taking a break from checklists or have-tos. And just sitting right here, right now. Maybe bringing a hand to the belly and noticing how the belly rises on the inhalation and releases on the exhalation. Or perhaps for you, the breath is more vivid at the lungs. If that's the case, just paying close attention to the chest expanding with the in-breath and releasing on the out-breath. This breath breathing itself. And of course, the mind will wander. That's what minds do. And anytime you notice that the mind has wandered into judging or planning, story making, wondering, that's the moment of mindfulness. That's the moment of noticing where the mind is. So congratulating yourself for noticing that your mind has wandered. And then gently and with great kindness, offering the opportunity for the mind to come back to this very breath. Maybe for you, it's easiest to notice at the nose, the nostrils. The cooler air coming into the nostrils and the warmer air coming out of the nose, having been warmed by the body. No need to focus too hard on this or try right now. We're not trying to have the breath be any certain way. We're not even trying to relax. Just letting go of trying completely. And just being right here with this breath, however it is. And if there's a baby growing within, and you're noticing the movements of the baby, Or perhaps if your baby's too small for you to be noticing the movements quite yet, just acknowledging the remarkable ability of a body to grow and nourish another human being within. Allowing the mind to come to this baby within, being with this baby right now. And as you're ready, coming back to this breath. Noticing whether it's possible to pay attention for one complete in-breath. Noticing the pause between the in-breath and the out-breath. And then seeing if it's possible to pay attention for one complete out-breath. And where is the mind now? Wherever it is, it's no problem. Just noticing and bringing the mind back to this breath that you'll never have again. And as this meditation comes to an end, perhaps taking the deepest breath you've taken all day and stretching the body in any way that the body is asking to be stretched. Opening the eyes when you're ready. And I'd love to hear what you noticed. What was your experience during that brief meditation? Feel free to unmute or type in the chat, whatever serves you. How was that for you?
I can share. This is Raya. Just finishing mindfulness-based stress reduction. This is very familiar. And I loved how you just brought attention to the idea that you can never have this breath again, that the breath is so in the present, and it enhanced my ability to kind of connect and bring my awareness into the moment. I appreciate that.
Thank you, Raya. Incredible that you're doing MBSR and totally relevant, as you'll see as we go through. Thank you, Rachel. And I do think it's so interesting. We are so often, many of us are used to needing to follow our thoughts. And in fact, the first time I practiced back in 2003, one of my feelings of resistance was, but I like thinking. I really like thinking a lot. And I still love thinking 30 years later. Or is it 20? It's 20 years later. And sometimes my thinking is not helpful to me. Sometimes it's anxiety or, rehashing. So yes, practicing having the choice, choosing when I'm in front of my teenager. Do I want to keep thinking about that work thing right now? Or do I want to make the choice to come back? Yeah. Marjorie, thank you. Yeah, great. We're about to move into the myths of mindfulness. And one of them you're sort of previewing for us, which is your mind is supposed to be clear. And even people who have practiced and practiced for years and years and years, maybe you experience moments here and there where your mind is clear, but that's not the goal. Yeah, minds wander. They go away and come back over and over and over again. Anybody else, China or Jessica, anyone else want to share about your experience? And zero pressure here.
It's just so lovely to slow down and be still. I've had a lot of busyness already this morning, and so it was very nice to just be.
Thank you. We'll have a bunch of moments of being today. And I would invite you to, even if you can, even turn off your phone. Really give this time to yourself as a gift. One of the opportunities that's coming, in addition to teacher training, which we recently found out in the past couple of weeks, we have a funder who's given us a lot more scholarship funding for the teacher training that's coming in the fall. So we'll talk as we go through about the opportunities that are available in terms of teacher training in the fall, but we're also having a retreat in October, which will be 5 days of more extended what we're doing right here today. Today is a very condensed version. But yeah, it is not a selfish thing to take these moments of just being, because the impact of these moments often will ripple out into our families and communities. So I'm going to share my screen again. Yes, and it does make a difference to have community for sure when we're practicing. Sometimes it can make it feel easier or reinforcing. Thank you. If you ever can't see or hear my screen, just let me know. Here are some common mindfulness myths. Again, I'm not going to read the entire thing word for word, but thank goodness you don't have to be calm or stress-free to be mindful. I think this is such a big one. The stereotype of mindfulness or Zen is, whatever happens is fine. That's not real life. And if you had to be calm all the time, I would have flunked out of mindfulness on my first day. Mindfulness is about being with whatever is here. And sometimes, in fact, we'll really get into study after study that shows that mindfulness-based stress reduction reduces stress, as does MBCP. But it's not about being stress-free. It's also not about trying to clear your mind. And it's not about sitting in a particular way. Again, there are stereotypes out there. And sometimes it is helpful to have a certain place in your home where you sit, or a special cushion, but those things are not necessary to be aware of what is happening in this moment. Mindfulness, rather than being something that encourages people to accept unacceptable conditions or to be more passive, mindfulness can actually often increase people's capacity for responding to unacceptable conditions in the most effective way. So you sometimes hear the word acceptance, but probably the word acknowledgement is a more accurate word for what acceptance means in the context of mindfulness. So acknowledgement is, this is here. And then the next question can be, now what? So rather than being in denial about a certain dynamic that's happening in the room or in the community or in the workplace, or rather than accepting it without being critical of things that deserve our criticism, we can acknowledge what is here and then ask ourselves, now what? What's the most effective way to respond? Of course, mindfulness is not a religion. I hope that you experienced not having to breathe in any certain way. It's not helpful in labor or in life if someone instructs you to relax. You don't have to breathe in any certain way. And mindfulness is definitely not for a particular population. Again, there are stereotypes around this too. But as we go through today, we'll definitely be exploring the ways in which anyone can practice mindfulness. And in fact, it's perhaps most appropriate for people who are affected the most by health disparities and the chronic stress of racism and other stress. And I can't see your squares, but does anyone want to unmute and add anything in this moment before we move on? All right, so mindfulness-based stress reduction. Really important for us to go back to the 1970s when Jon Kabat-Zinn started MBSR, Mindfulness-Based Stress Reduction, at UMass Memorial Medical Center. He created this 8-week program to make mindfulness more accessible. And he said to the doctors at UMass Memorial Hospital, send me the patients who are not getting better. And he had them go through this 8-week program in the basement of the hospital. Since 1979, over 20,000 patients have gone through this program. There have been numerous clinical trials. And as you probably know, MBSR is all over the world at this point. And since he started, this is back in 1980 at the very beginning of this graph, and now here in 2015 at the end of this graph, you can get a more updated one too, but the amount of research has grown exponentially, showing the impact, the effectiveness of mindfulness-based stress reduction, where people come together for 8 weeks in a row to practice in community and also agree to do homework at home, which is mindfulness practice, awareness of breathing 1 week, the body scan, which we'll practice later 1 week, and so on. And even Jon Kabat-Zinn was surprised about some of the outcomes related to MBSR. I'm listing just a few here. Reduction of pain, reduction of anxiety, depression, increased immune system response. We're talking about research studies where immunoglobulins and other immune system factors were measured. Social and emotional intelligence, empathy, and compassion. Sounds pretty good in relation to parenting a middle schooler, for example, or someone who's just starting first grade, or a new baby. So how does mindfulness influence these outcomes? Well, we know that constant fight or flight is bad for us. that it was good when back in the day when tigers were chasing us, it was good to be able to run away if a tiger started chasing us. Now, most of us don't have tigers chasing us anymore, but often we still are in fight or flight when something comes up, some stress response. And if we get stuck in fight or flight, there can be outcomes that are less than optimal. And we're not saying stress is bad. So in terms of performance, often you do have to have a little bit of stress to have peak performance. You might be a little nervous before you teach your first MBCP or MBSR class, or before you go in to see your patient, or before whatever it is that in your life. And that sometimes can help your performance. It's just that with the amount of stress, if it goes higher and higher, your performance goes down. And so let's talk a little bit about health disparities and inequalities. So as you can see, racism and discrimination runs across all of these different categories, these social and economic inequities. And we know that there's an impact of these inequalities and of this racism. So we know that, for example, Black women are 3 times more likely to die from a pregnancy-related cause than white women, regardless of socioeconomic status. We know that Native American women are more than 2 times more likely to die from pregnancy-related complications than white women. And we know that those numbers have gotten worse over the past 30 years. The Latinx maternal mortality rate was around the same number as the white maternal mortality rates pre-pandemic. But during COVID-19, the Latinx maternal mortality rate has surpassed the white maternal mortality rate. So those are just a few of the statistics, bringing them up because we're about to get into stress and the impact on perinatal outcomes. Preterm birth rates are higher for African Americans in the US. And of course, because of limited access to mental health treatment, things being undiagnosed, stigma that can be associated with mental health treatment and other treatment, there can be long-term effects on child development. We're talking about children losing parents or having parents that are quite burdened. And let's just take a minute to be with whatever is arising inside us in relation to this, because this is not easy. We also do know that socioeconomic disparities can make a difference in terms of postpartum depression, and that stress can impact preterm birth, postpartum depression, quality of mother-infant attachment, and that's a gendered word because that's how it is in the research. And here's a great model of the ways in which prenatal anxiety, chronic stress, depression can contribute to outcomes. So GA stands for gestational age, preterm birth, PTB, and LBW is low birth weight. There's a great meta-analysis of a bunch of different research articles. You'll get the slides afterwards today, and the Vanderberg meta-analysis is old, but it's also looking at a whole bunch of different research articles and linking maternal stress to cognitive, behavioral, and emotional problems in the child. Let's make sure that we're not blaming mom's stress for children having a hard time. So we have to be really careful about that. And we can acknowledge that anyone in the home can contribute to setting the atmosphere of the home. And that it's not just about maternal behavior or behavior of anyone else in the house, but it's also about epigenetics. We'll get to that. So Nancy Bardacke lives in the Bay Area in California. And she was a nurse midwife for many years, and then a mindfulness practitioner for many years. And one day on a retreat, it clicked that what Jon Kabat-Zinn was teaching in MBSR and everything she was learning in her own mindfulness practice could really be applied to pregnancy, labor, birth, parenting. And so that day, in Nancy's mind, she started figuring out how to apply all of that to the perinatal period. And she came up with Mindfulness-Based Childbirth and Parenting. This is her book that you can see on the right here. And here we are talking about epigenetics. So we have learned so much since that day that Nancy decided that this had to be put into a form so that it could be accessible to people in the perinatal period. You know, we already have this often cultural expectation that people will take some kind of childbirth education while they're pregnant. And so Nancy realized that if she could come up with some kind of program that included childbirth education and mindfulness, that there's already the expectation in place in many communities that they'll learn something in preparation for giving birth or parenting. And we know now, we didn't know then, that stresses and lifestyle and diet can all influence epigenetic changes that determine what genes are turned on and off during pregnancy. So looking at the world, the injustice that existed, the health disparities, Nancy really decided to start upstream, trying to figure out some kind of way to teach these life skills during pregnancy. And MBCP, Mindfulness-Based Childbirth and Parenting, has 4 intentions. You can read them here, but it's about decreasing stress in pregnancy, working with pain and fear before and during childbirth. And I have to say, if you can be with pain and fear, you're pretty set for life as well, because life includes pain and fear often. Parenting mindfully from the moments of birth. Remember, that doesn't mean being calm all the time. It means parenting with capacity for being with whatever arises. And interrupting intergenerational patterns of suffering. So often people come into our classes, and of course there are ways that people want to parent the way their parents did. And of course there are ways that they don't necessarily want to be on autopilot, parenting the ways that their parents did. And so MBCP, one of the intentions is to interrupt the not helpful patterns. In MBCP, just like in MBSR, there are evidence-based mindfulness practices. So we'll practice some of these today: the body scan, sitting meditation, etc. Participants practice for about 30 minutes a day, 6 days a week. Does everyone practice for 30 minutes a day, 6 days a week? Probably not. But again, it's like exercise. The more you put into it, the more you get out of it. And so before we go into one of our mindfulness practices, I'm just going to stop sharing for a minute and check in with you. Rachel, I love that your grandfather took MBSR back in the 80s. Any questions, thoughts, anything that has come up for you so far in this little introduction to MBCP? So I'm going to introduce you to the 3-step breathing space, which is one of the practices. Raya, is it still in MBSR also, the 3-step breathing space?
It is not something that I learned.
Okay, so it is definitely an MBCT, mindfulness-based cognitive therapy. And you might know that MBCT has been shown to be as effective or more as a first-line treatment for depression. And so in the UK, it is recommended as one of the first-line treatments for depression, as effective or more than medication, MBCT. And so in MBCT and MBCP, a lot of acronyms today, but we'll keep them organized. We teach the 3-step breathing space, which is like a practice in your pocket. It's a practice you can use anytime you want to bring yourself back to the moment. And it's one you can do in the middle of anything. You can do it with your eyes open. Nobody needs to know you're doing it. You can do it while you're holding a screaming infant. You can do it if you just got an email that kind of made you feel a little bit icky. You're sitting at work. A coworker is a little bit toxic, whatever it is. This is a practice you can use to shift gears, to change gears. And you can do it it's called the 3-step breathing space. You can do it in a couple of minutes. You can do it in 20 seconds. You can also do it if you're feeling a little out of touch with how your body is. Like, let's say you're having a children's birthday party and it's just very exciting. There's a lot going on and you're just noticing yourself feeling really distracted. Or a really joyful event, but you're feeling like you're not really there because it's just so exciting. You can also do it to ground yourself in moments like this. So I'll share my screen again because it can be helpful. Oops, let's go back. It can be helpful to think of this practice in the shape of an hourglass. So starting wide, what is here? Narrowing to the breath and widening back out to the body. So when I'm leading you through this 3-step breathing space now, we will, you're invited to close your eyes. You don't have to. But of course, when you're at work or in the middle of your kids or whatever it is, you feel free to keep your eyes open, whatever works for you. So if you'd like right now, you can close your eyes. And now step 1, just noticing what is here. What thoughts are here right now? What emotions? What body sensations are here right now? Just checking in with yourself. Like taking the internal temperature. Resisting the temptation to want things to be different than they are. Just noticing what is here right now. Being with whatever is here. And when you're ready, narrowing the focus of attention, step 2, to just this in-breath. and just this out breath. Like shining a flashlight of awareness on the breath, breathing itself. And now step 3, expanding the awareness around the breath to include the body as a whole, as though the whole body were breathing. Sitting here in the envelope of the skin. Complete just as you are. And if your eyes have been closed, opening the eyes when you feel ready. What did you notice? Was there a difference between before and after? Or not? When people are postpartum, so people come to take MBCP usually when they're in their 3rd trimester. And then about 6 weeks or so after everyone has given birth, people come back for the MBCP reunion. And often people mention that they use the 3-step breathing space most often, that and loving kindness, when they come back for the reunion. Thank you, China. Interesting, less connected to the body sensations you were holding. Do you want to say more about that?
I'm just noticing that, like, even just a little bit of tension in my body, or like in my neck, or maybe just a little, like, noticing hunger, but not quite as connected to those feelings just after that brief practice.
Thank you. Thank you so much for saying that. People are often, when they start to practice, more aware of fatigue or tension or whatever it is. And sometimes that can be really directive. Like if you're noticing sleepiness, maybe the most compassionate thing for you is to give yourself a nap, right? Or maybe just by noticing, which I feel like is part of what China is pointing to, sometimes just by noticing the physical sensation or your relationship to it can change. Yeah, thank you so much for contributing that. And Rachel, yeah. So yes, big, intense feeling or thought. This is exactly when you can decide if you want to use this 3-step breathing space. And you can imagine how you can do this with your eyes open. So even right now, let's do a 3-second one. What's here right now? Noticing these faces, noticing what thoughts, what feelings. And now narrowing, coming to this breath. And now expanding out. I have a body. So often we walk through the world as though we're just heads, just brains and to-do lists and things to figure out and do next. And in reality, we have access to this whole body often. Yeah, living from the neck up, exactly. Yeah. So this section of today has been our introduction to mindfulness and just a little bit about MBCP and MBSR. When we come back from the break that we're going to take in a few minutes, we're going to move much deeper into MBCP. We're going to do a practice, a teaching that is often responsible for a major shift in perspective around pain and around fear in MBCP. And I'm thrilled that we happen to have some people in the Zoom room that are actually pregnant right now, because it's always a good review before it's time to go into labor and give birth. But before we move into our break, what else is coming up for people in terms of, Raya, your recent experience with MBSR, or anyone else? Thoughts, feelings, hopes for the next couple of hours of our life together. And hopefully you got the email a couple days ago asking you to have some ice at the ready for later. Don't bring it back when you come back from this break. We'll have another 5 or 10 minute break later, when I'll ask you to go grab some ice. But if you haven't gotten any, now might be a good time when we take our next break to just have a little bit in a bowl at the ready. You just need a medium-sized bowl of ice later on today. All right. So we will take a 15-minute break now. You can experiment with, and who knows what your situation is. You might have a house full of people and it might not be possible for you to do this. But if your house is not full of people, or if it is possible for you to do this, you might experiment with having this break in silence, with noticing your feet on the floor as you walk to the bathroom or to get a drink, to take care of the body in whatever way the body is asking for. Noticing hunger and what changes when you eat, noticing chewing. So if you want to extend your mindfulness practice, again, we don't have to be sitting down for this. We can do mindfulness at any speed. One of my favorite mindfulness teachers says. If you are interacting with people in your house, maybe noticing what you're feeling inside as you're interacting. So it doesn't have to be silent to be mindful either, right? What are you noticing in your mind and body as you're interacting with people in your home? And as you're saying, I've got to get back. Would anyone like to share how your break was? What came up for you on the break, or any other questions or thoughts you have before we jump into MBCP class 3? All right, I'm just going to share my screen. And I'm inviting you in to MBCP class 3, which is often responsible for a major shift in perception. Just like in this picture, you might see a bunny and also a duck. The shift in perception that takes place during MBCP class 3 is often one that comes after people have had 2 weeks of mindfulness practice. China, we're so glad you're back. Welcome back. I'm inviting you into MBCP class 3. So if you know the MBSR, Mindfulness-Based Stress Reduction curriculum, you know the Raisin meditation. In class 1, we pay very close attention to a raisin. We do some awareness of breathing. People practice that for a week. In class 2, we're still getting to know each other. We practice the body scan, which is a practice we will do here today before the next break. And then we tell our participants, by the time you leave class 3, you will understand how this all relates to childbirth. I promise. And in class 3, we do this whiteboard teaching that I'm condensing a little bit for this information session, but you'll get to experience some of it now. So if you'd like to unmute yourself so we can talk a little bit more freely during this little presentation part, the whiteboard, feel free. You don't have to. We start out by asking our MBCP class, our pregnant participants and their support people, if they have people with them. People often come by themselves. People often come with partners or family members or friends. What is pain? So we establish, does anyone want to offer up what pain is? Pain is usually a message from your body to you, often a useful message. Don't keep your hand on the stove. And throughout our lives, before we give birth, pain has often meant injury. Ooh, I might have sprained my ankle. Or illness. I think I might be getting sick. I might need to go to a doctor for this throat, whatever it is. But we ask our participants, is the pain of childbirth an injury? It's not. Is the pain of childbirth an illness? No. So I'd like to offer you another category of pain, because what is the emotion that usually goes along with either injury or illness? Sometimes, especially when you're a child, but throughout your lifetime, often the emotion that goes along with injury or illness is fear. But since the pain of labor and birth is not an injury or an illness, let's come up with another category of pain, which is called transformational pain, the pain of a huge transformation. It took up to 40 weeks or so or more to grow this baby. And the baby is going to go from inside the body to outside the body in a very short time. So it's the transformation of a human being coming from inside the body to outside the body. And your baby is going to have transformational pain too. Can anyone think of a time when infants or toddlers have transformational pain? Teething is an example of transformational pain. So when a baby is teething, their teeth are coming in. It's not an injury. It's not an illness. It's a transformation so that they're going to be able to chew on food. So there's also transformational pain with growing pains for adolescents or with the aging process, pain that is not signifying an injury or an illness. So then we break down pain into the three components. Sensory is how the pain feels in the body sensations. Emotional or affective is how we feel about the pain. And cognitive is how we think about the pain. So pain has these three components: how it feels in the body, how we feel about it, and how we think about it. And what we're doing when we're practicing mindfulness is we are uncoupling, we're separating the sensory from the emotional and the cognitive. And we're not just talking about labor, we're also talking about pain in life, emotional or physical. So next time you feel emotional pain, what would happen if you focused in on the sensory experience in the body? When we separate the sensory, the physical sensations, from how we feel about it and how we think about it, we are essentially separating the pain from the suffering. And then we ask participants to do the math. So each one of these big waves is a contraction, and each little tiny bump that is drawn over the wave is a breath. It's not drawn to scale. But if you're having contractions every 5 minutes and they're lasting a minute, how many minutes of pain is that in 1 hour of labor? And people do the math, and it's 12. It's 12 minutes of pain in 1 hour of labor. How about if you're having contractions every 3 minutes? lasting 60 seconds. If you do the math there, that's 20 minutes of pain in an hour of labor. Can you do that to get your baby born? Now, what's happening in between contractions? And we always tell the truth in MBCP. So at this point in the class, we would bring up that if you happen to be one of the around 15% of people who have back labor, which is something we teach about in MBCP also, it's not that you have no pain in between contractions, but it will be much less in between contractions. You still have some discomfort from the back of the baby's head bumping up against your sacrum. But for most people, what is happening in between contractions? And before I switch the slide, if you're really paying attention, your contraction starts less intense, builds up to a peak, and then decreases. How many seconds is the maximum pain? How many seconds of maximum pain in each contraction? It's about 3 to 5 seconds at the peak of each contraction. And how long is one breath? About 3 to 5 seconds. So we're also talking 12 breaths of maximum pain in 1 hour of labor. All right, so let's move on to what's happening in between contractions. This is a busy slide, but in between contractions, your body is pumping in feel-good hormones, opiates, endorphins, a whole chemical bath into the body to help you to relax and rest in between contractions. So then the question is, why aren't all of our friends talking about this? There's a thing where people are telling each other their birth stories, of course, because it's a very significant time in people's lives. And it's rare to hear people say, you should have felt the time in between the contractions. Why is that? Well, it's because for most people, in between contractions, people are thinking, oh my gosh, that last one was so hard. Oh my gosh, that next one is going to be impossible. Oh my gosh, why am I doing this? You missed it. And so most people who haven't used a mindfulness practice miss the space in between the contractions. And of course, we're not just talking about labor, we're also talking about life. We have contractions of life all the time. And sometimes, like right this moment, perhaps you're in between one of those contractions, or perhaps you're in the middle of a week's long contraction right now, but you're here right now. It can be so hard to not be thinking about how bad yesterday was or how hard tomorrow is going to be. But when we practice mindfulness, we are training the mind to come back to this moment, because this is the moment we have right now. This is the moment we're living. And it can be helpful in labor. So I love this picture. And before we move on to a body scan, I just shared with you about half of the whiteboard. It's actually longer in the actual class. If you take the teacher training or you come to our retreat in October, you'll see the other components of the whiteboard. But any thoughts, comments, wonderings before we move on to a body scan meditation?
Yeah, Jen, I do. This is Raya. What a beautiful example that I honestly think would be so beneficial to have learned in MBSR, because it's it's incredible to think about it in practicality of contractions. But like you mentioned, like it can also be like the stressors of our week, or, what a really, really cool idea.
Yeah. Thank you for saying that. It can be really powerful. And sometimes, because life has, we are all experiencing contractions all the time. And so, sometimes it is really hard to just let ourselves be in a moment of ease or maybe even joy, in between all these other things that we have going on. But our kids can feel when we give ourselves permission, or when we allow ourselves, invite ourselves to just be right here. And besides our kids feeling it, maybe some of us have cats or dogs as kids, or have chosen not to have kids. We feel it too. There's a contraction. I don't know how that happened. I'm going to fix that. And then we're going to get into a position to do a body scan. Anything else though before we do that?
This whiteboard, like in its entirety in the book, is what really sold me on. I read the book, the teacher training I just finished up in over the summer. So, and now obviously preparing for my second birth experience, but that whiteboard is what really brought me into this work and really made me appreciate it. So I remember kind of having that feeling too, Raya, when you hear it, you're just like, it just makes so much sense. This perspective is so helpful.
Rachel, did you just raise your hand on purpose?
Is my mic working?
Yes.
Yeah. I really appreciate that not only does this address that, I forgot what you call it, uncoupling of pain as a message that something is wrong, but also that like the overarching concepts aren't teaching that if someone's experiencing pain, then they're doing it wrong. Because after all of these years of working with birthing people, and some of them delve very deeply or work very hard on very specific methodologies that seem to lead them to, if I just do this methodology perfectly, I'll feel little to no pain. And then they experience labor and have the tools that they brought. And then I often hear them express major disappointment in themselves that they failed because they experienced pain. And that's not awesome. So,
Yes.
I mean, I do feel like part of what attracts me to this is finding how important it is to share these core skills and concepts, not just for pregnancy, birth, and postpartum, but for these people as parents and their children. And I know we're all like preaching to the choir here about that sort of lifelong impact, but I do love the way that helps lay that out in a way that experiencing pain doesn't mean there's something wrong, and you didn't do it wrong if you are experiencing pain.
Thank you. And thank you for that heart, China, too, because this is huge. This is so big. And it is one of the things that separates MBCP from most of the childbirth education that I had experienced as a midwife before I met Nancy. In MBCP, we say that natural childbirth is having a baby come out of your body. That's natural, because we have no idea what is going to happen when somebody goes into labor. I mean, you can do lots of preparation to increase your capacity, to set up all the conditions for having the birth experience that you're hoping for. But childbirth education that promises people a certain outcome is not honest. It's not. And in MBCP, we call pain pain. And we are very honest with people that we don't know. So beginner's mind or don't know is one of the attitudes of mindfulness. And we could go into attitudes of mindfulness, or you can Google attitudes of mindfulness after this little taster session today. But in all of our practice, throughout the 9 weeks of MBCP, we are cultivating the attitudes of mindfulness. And one of those is don't know. So for example, oh my gosh, I'm 3 centimeters and I'm already in so much pain and it's just going to get worse and worse. Maybe. We don't know. Maybe 3 centimeters is going to be the hardest time for you. Sometimes being 5 centimeters for 24 hours is way harder than being in transition. We don't know. And so by the time participants leave the MBCP class, they are actually hearing in their own heads when they're saying to themselves, oh, my baby was awake until 1 a.m. for the past 2 nights. I don't know how I'm going to get through tonight. Tonight's going to be awful. Then often they're saying that they're hearing another voice in their head saying, maybe. We don't know. It could be awful. It could be totally different tonight. So yeah, one of my favorite stories about this particular thing that I'm so glad you brought up, Rachel, is one time we had somebody in our MBCP class. They loved the class, and I was reading the hospital sign out after they gave birth at work, and I saw that they had a vacuum delivery and a 3rd-degree tear, which is a tear that extends to the rectum if you're not in midwifery or the birth world. And my heart kind of sank when I read that she had had this awful tear and a vacuum delivery, just because I'm human and I would have wanted it to be easier for her. And my phone rang, my cell phone rang at that exact moment, and it was her husband. And I picked it up and I said, hello. And he said to me, it worked. It really worked. So it's like, I have definitely seen over and over people's mindfulness practice helping them kind of as a PTSD prevention measure, because they go into labor knowing that, you know, I have all these tools. I'm going to take 1 minute at a time. If you read the Mindful Birthing book, you'll see that we offer lots of very concrete things in terms of responding to whatever comes up. An intervention is offered. Pain, we'll be practicing with ice in a little while in this little taster session today. People have all kinds of tools, and we know there are many things in our control and many things out of our control, just like in life. So yeah, going in not expecting that we can control everything is a much more realistic way to go into labor and actually into life. I mean, gosh, it would be great if we could control more in life, and we can control a lot, and we can't control everything. For example, this little screen behind me has never fallen before, and it just fell 2 times in one taster session. I mean, ridiculous. So now, is there anything else before we move along to the body scan? Okay. So what we're going to do now is a body scan meditation, where we are paying attention to each part of our body. I will guide you through this meditation. It is traditionally done laying down. So if you want to either turn off your camera or not, and find a place to lay down while I lead you through this meditation, you can. I will keep my camera on and I'll be sitting up. You can do whatever you want. As I lead you through each part of the body, please listen to yourself more than you listen to me. So you might notice your mind wanders. When your mind wanders, you can bring it back to the instructions, to the part of the body that we're at that moment. If it's ever more helpful for you to pay attention in a different place or just to bring the attention back to the breath, you can feel free to do that. What if you decided right now that for the rest of our session together, you are not going to rush? We have another hour and 15 minutes together. What if you decided you're going to give yourself the rest of our time together and not rush at all? So really taking your time now to get comfortable. Laying down or sitting up, whatever you choose. And if you're not ready yet, if you want to unmute and let us know, because we don't have to rush. And so I will lead this practice as if you're laying down, but of course you can adapt my directions in whatever way serves you. So beginning now by putting the hand on the belly again and noticing the belly rising with the in-breath. Releasing on the out-breath. This breath that began in the moments you were born in this way, when the air hit the chemoreceptors on your face and your lungs expanded, your circulatory system changed for the first time. This breath that's always in the present moment. And when you're ready, allowing the attention to come up past the chest and neck and face to a point at the top of the head, a point a few finger breadths behind the hairline, the place that was the soft spot on the top of your head when you were born. Just noticing what sensations are here right now. Sensations of throbbing, itchiness, coolness or warmth, tension, tightness or ease. Just noticing what is here. And now expanding to include the sides and the back of the head. Noticing contact points between the pillow and the back of the head or the sides of the head if you're laying down. What sensations are here now? On the scalp, all the little hair follicles, the places where the head makes contact with the surface beneath, and the place where that contact dissipates. receiving my voice through the sense doors of hearing, through the ears. And now bringing the awareness to the left side of the forehead, sweeping the attention across the forehead and noticing what sensations are here in the forehead, the eyebrows, the space in between the eyebrows, a place where many of us hold tension. And if you notice any tension or tightness there, just being with whatever is here, breathing right into any places of tension or tightness. And on the out breath, bringing the awareness now to the eyes, the eyeballs resting in the eye sockets, the eyelids. And now to the cheekbones and cheeks, to the nose, the bridge of the nose, the nostrils, cooler air coming in and warmer air leaving the nose, perhaps can be felt on the skin right underneath the nostrils. Noticing any sensations in the jaw now. And seeing if it's possible to allow the jaw to soften in any way. Maybe it is, maybe it's not. Just noticing what sensations are here in the jaw, the chin. And now outside the mouth, the lips, is there any moisture or dryness? Are the lips touching each other or parted? And what sensations are inside the mouth? The tongue, the roof of the mouth, the teeth and gums, the soft inner cheeks. What is here to be noticed right now? And maybe there's a lack of sensation in some place, and that's just fine. Just noticing that. Breathing in, and on the out breath, bringing the attention now to the neck, the throat. Perhaps feeling the breath in the throat. Noticing what sensations are here in the front of the neck, the sides, the back of the neck. Breathing right in, and on the out breath, bringing the awareness to the shoulders now, both shoulders, fronts, sides, backs of the shoulders. And anytime you notice that the mind has wandered away into planning, judging, whatever, congratulating yourself for waking up to where the mind is and escorting the mind back to wherever we are in the body, which right now is in the armpits, upper arms, biceps and triceps, elbows, lower arms, the wrists, all the tiny bones of the wrists. And now breathing right into the hands and noticing what sensations are here in the backs of the hands, the palms, the fingers, the space in between the fingers and thumbs. What sensations are here in the hands right now? Heaviness, tingling, moisture. Whatever is here, just being with the body sensations in the hands. Breathing into the arms and hands, and on the out breath, bringing the awareness back up the arms and to the chest, to the breastbone and breasts, to any sensations in the chest area, the heart and lungs. The heart that's pumping blood all around the body, and to the baby's body if you have a baby within. Perhaps being aware of that sensation. Perhaps feeling the expansion of the lungs in the back area. If you're laying down, getting curious about how it feels to breathe in. Bringing the awareness now around to the back, the upper back, mid back. Breathing right into the lower back. Just noticing what is here now. And on the next out breath, bringing the awareness around to the belly. Perhaps noticing sensations of hunger, discomfort, or perhaps noticing the baby's movements. Just being right here with these sensations in the belly right now. Breathing right into the belly. And on the out breath, bringing the awareness to the pelvis, the genitals and the buttocks, and all the bones of the pelvis that can expand, that are already being impacted by hormones if you're pregnant right now, so that they can expand to allow a baby to come down and through and out. Breathing right into the pelvic area, and on the out breath, bringing the awareness now to the hips and thighs. What sensations are here in the upper legs? Noticing what is here, noticing contact points, the sensations of clothing on skin. Breathing right into the upper legs, and on the out breath, bringing the awareness to the hard parts of the tops of the knees, the soft place underneath the knees. And now to the lower legs, the calves and the shins. What sensations are here in the lower legs right now? Allowing yourself to be supported by the surface beneath. Breathing right into the lower legs. And on the out breath, bringing the awareness to the ankles. And now to the feet. The soles of the feet. the tops of the feet, all the toes and the space in between. And now expanding the awareness to include the entire body. Here, right now, in the envelope of the skin, that thin, porous membrane that separates us from the outside world. Being aware of the air on the skin, clothing against the skin. Seeing if it's possible to be aware of the body as a whole. Lying here just as you are. Nothing to fix or change. Just being right here. And now breathing in as though you could breathe in and up to a place at the top of the head. And breathing out as though you could breathe down and out through the bottoms of the feet. Breathing in and up and down and out. And now narrowing the focus of attention once again, just to this breath at the belly. Perhaps bringing a hand to the belly once again. Just being here in stillness. And perhaps in peace. And when you're ready, setting the intention to come back into a sitting position with your eyes open and your camera on if you wish. Setting the intention to do this in the most relaxed and spacious way that you can. So really taking your time now, no rush. As you move back into a sitting position, it's possible that you fell asleep. That happens often. If that is the case, just thank yourself for the fantastic nap. And I'll give you some body scan resources later today. Raya, it's so good to see you. How was that for people, that body scan? What did you notice? What was challenging or surprising? I love that people are taking their time coming back. Feel free to either unmute or type in the chat.
I can, this is Raya. I can definitely share how it was different from MBSR. I just finished the 8-week class where for the first time I did not fall asleep in the body scan. And so today felt really wonderful to make it through. When my facilitator was leading, it was very much internal in the body, never really bringing a mindful awareness to kind of like that 3-step that you were talking about earlier, expanding your awareness to around your body. And so that was really wonderful. I also really appreciated the pregnancy edition. Yeah, it was very, very well done. You're a very skilled facilitator. Thank you, Jen.
Of course. Thank you for the feedback. And hopefully every body scan you do ever will be different, right? China. Yeah. Thank you for that.
I felt like it took me until we got to the legs to really feel like I was having a real moment of mindfulness. And then even then it was pretty fleeting, things were happening around me, noises. So I was surprised how even different moments of the body scan felt like a very different experience.
Yeah. Anyone else relate to that? I definitely did. Yeah. Thank you. And sometimes people come into mindfulness feeling like it's a good meditation or a good practice if there's less distractions. And actually, practice is practice. So it's not better or worse if there are more or less distractions, or if you're noticing, gosh, I just did 30 minutes of practice and I really feel like I only was actually mindful starting at the legs. That's still practice. It's still noticing what is here. And in real life, we're distracted and our attention is pulled back and forth all the time. So just a reminder that that practice is just as valuable as a practice where you felt mindful the whole time. It's all practice. Yeah. Thank you for contributing that. Appreciate it. Other noticings.
Been a little while since I've done a body scan style meditation, and I second Raya's appreciation of your facilitation. I found myself needing to remind myself that I wasn't just like taking inventory of tension or discomforts, because in some areas that would be the first thing I would notice. And then kind of inviting myself like, okay, and yes, and, or like that's there, but it doesn't need to take up my whole focus or stay there. And I felt like that got better for me as the meditation went on.
Thank you for saying that. There's also a lot of both and in the MBCP class. This is here, and what else is here? And you'll see that when we practice with ice in a few minutes. Yeah, thank you. And part of what we're doing in our teacher training is providing you with the ability and capacity and personal practice to be able to lead meditations for groups of people in your community. And so I do want to we'll put in a plug at the end, and Dawn will come back on and we'll answer more logistical questions about the training if you're interested. But I just want to make sure you know that we have funding to support people taking the training. And this retreat that we have in October, we specifically have funding for people who work with or are people who are impacted by health disparities. So we definitely have funding. And if that body scan just now was something that felt in any way good for your life, we would love to welcome you to our 5-day retreat from October 8th through 12th, or into the teacher training. We have space, we have funding, and we are committed to decreasing health disparities by making sure that anyone who wants access to mindfulness-based childbirth and parenting can find classes near them. So, anything else before we take a short break to get some ice?
I just feel like I'm soaking up getting to practice today with you all. It just, my body's like, this feels so nice to be here. So just very, very happy. Thank you.
So glad you're back. It's so nice to see people who I got to know so well over a period of teacher training. Yeah, thank you. And the difference, another difference between a childbirth education class and a mindfulness-based childbirth and parenting class is that the teacher is practicing daily or as close to daily as we possibly can. Because if you're teaching childbirth, but you're not practicing as close to daily as you can, you're not an MBCP teacher. So being embodied, like you can feel your practice in your body. When we're leading practices in MBCP, it's not that we memorized a script. It's not that. It's that we are practicing with our own body. And so that's why it's different every time, because it's not scripted. But of course, there's a structure for each practice, which you would learn in the training. So we will this time take a 10-minute break. We will come back at 20 past the hour. And if you could bring a medium-sized bowl of ice, we'll be using it to practice the discomfort of contractions. I'll see you at 20 past the hour. Welcome back. So part of what we do in the MBCP class is we practice holding ice for the length of an average contraction. So we actually, as teachers, have stopwatches, or we use the stopwatch feature on our phones to allow people to have the experience of being with discomfort. And here's a picture of a couple in one of Nancy's classes doing some touch practice. So I'm just going to stop sharing my screen so we can see each other. And hopefully you have your bowl of ice. We're just going to do 10 minutes of pain practice with ice right now. You should know that in the MBCP class, we do about an hour of pain practice 3 different times in classes 4, 5, and 6. So there's individual pain practice where a partner or a support person, or sometimes if people come alone, they pair up. They're practicing different touch practices. And then we also have a pain practice in class 6 with people making sounds, submerging their hand or hands in ice water, experimenting with swaying. So being able to practice a lot of different ways for dealing with discomfort. So we're doing a very tiny fraction of the practice that we do in the class, but you'll get a taste. I'm going to pull up my stopwatch real quick. And what we're going to do is I'll say it's time to pick up the ice, or the work is starting now, or your contraction is starting now. And I'll time us for the length of an average contraction. You're just going to hold the ice in one hand, not yet, but when it starts. It would be great if you could unmute yourself, because for this first contraction, I would like you to complain as much as you possibly can. Complain, 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 complain. And you're just holding the ice in one hand. So pick a hand. Go ahead, and your contraction is starting now. Pick up the ice in one hand and complain, 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 complain. Woo, it's so cold. Why are we doing
By
this?
me.
Woo. Yes, it's so cold.
Not pleasant.
Not pleasant.
Tripping on my clothes. Ew.
Yeah.
Wishing I brought a towel over here for this.
Kind of burns.
Ooh,
Not how I want to spend my time today.
no.
Mm.
Why are we doing this? Ooh.
Oh.
There's definitely discomfort.
Mhm. Keep holding the ice.
Oh.
Keep complaining.
This is not fun. Why am I doing this?
Why do we have a whole bowl of ice? I only need one cube, right?
Hold your ice. Complain as much as you can. Bring it on.
Still burns.
Ooh.
Ow. Ow.
My cats think I'm crazy.
Okay,
Done.
down that contraction is over. Go ahead and dry off that hand
ya.
if you wish. All right, that was ordinary mind. Ordinary mind. Get me out of here, mind. Okay. For your next contraction, I want you to pick up the ice in your other hand. Okay, the hand that hasn't held ice yet. So pick it up in the other hand this time. And this time, I want you to pay attention to the breath as though your life depended on it, because it might. Okay, your contraction is starting now. Pick up the ice, no talking this time. You're going to pay attention to the breath as though your life depended on it. Breathing in and knowing breathing in. Breathing out and knowing breathing out. Wherever the breath is most vivid for you, at the nostrils or at the belly, at the lungs. And anytime your mind wanders away, bringing it back with kindness to this very breath, however it is. Seeing if it's possible to pay attention for one complete in-breath. And one complete, that's over, put it down, your contraction's over. All right, so while you're unmuted, tell me what you noticed. How was that?
Shorter.
So much shorter.
The second time? And they were absolutely the same amount of time, 60 seconds each. If you happened to feel like the first time was shorter, that's okay. Sometimes people find the distraction feels shorter. And ice is different than contractions. What we're doing now is we're putting a whole lot of tools into our toolbox. It's possible that the thing that you try now that feels like it's really effective will be less effective in labor. And the things you try now that don't really resonate today are the most effective things in labor. So for the next few minutes, we're going to try just a few more contractions. And again, in the class, it would be many more than this. But we're just going to try a few different techniques over the next 5 minutes or so for managing discomfort. If you'd like, you can pick up the ice in both hands, or you can go back and forth. Totally up to you what serves you today. So, any questions or reflections before we keep going?
I definitely feel like that's a practice. Like I would have to practice drawing my attention away because I was super aware of both my breath and my pain.
Yes, yes. And in labor, the attention might go back and forth between the two. And actually, that's the next practice we're going to practice with the ice. So yeah, it is all of it's a practice, tuning right into body sensations, right into breath. Yeah.
Well, I'm glad that we're doing this because it's been a while since I have, and I'm remembering that focusing on my breath, like in my belly, doesn't help much, but focusing on my breath in my nose does, whereas that's typically not where I would focus on my breath in practice. So I was like, oh, it's good to remember.
So interesting. Yeah. And that might keep changing.
Right.
Okay, so when you're ready, you can pick up the ice. Your contraction is starting again. It's time to work. You can have your eyes open or closed, one hand or two, but this time we are going to dance back and forth between having the attention on the sensations in the hands and then bringing the awareness to the breath, playing with moving back and forth. Now to the sensations in the hands. Getting curious about this sensation. Where does it start? Where does it end? Is there a place on the arm that's not in pain or discomfort? And then moving back to the breath, back and forth as you're ready. Now to the breath. Back to the sensations, and you can put the ice down. That one's done. And now in between contractions, let's come back to the breath, allowing the eyes to close if you feel comfortable with that, or leaving them open. But what is it like to just be right here in this body in between contractions? Drying off the hands, maybe warming up the hands. Maybe doing an abbreviated body scan right now. Noticing sensations in the head and the face, the neck and shoulders, the torso and the arms, the pelvis, legs, feet, and the body as a whole. Just sitting here in this moment, resting in between work. And now picking up the ice again, time to work. This time picturing an imaginary baby in your head. This is a baby you may not have seen before, an imaginary one, maybe picturing their little face, fingers, toes, little cheeks. Imagining holding this baby. Maybe imagining the sounds that the baby's making. The weight of the baby in your arms. The baby's little belly. The baby breathing with your breathing. And that one's over. You can put the ice down and dry off your hands. And we're done with ice. So you just got maybe about 5% of the ice practice from the MBCP class. There are many other tools, and one of the most important ones is it's your labor, it's your birth, make it up. So we often are telling people, think of a prayer or a song or a quote or a phrase that's been helpful to you in your life, or that you think would strengthen you when you're in labor. And you can come back to that song or prayer or quote, but it's your labor, it's your birth, make it up. People are the experts of their own lives, even if they don't realize it. Often they realize it more by the end of MBCP. So I wish we had 3 more hours instead of 30 more minutes, but I want to get a chance to share some of the research around MBCP with you. So I'm going to go back to the slide. There's ice practice again. All right. And oops. Okay. So in terms of research, how do we know that MBCP is effective? What has the research shown? And before we get into the MBCP research, what has research on the fear of childbirth shown? What we've seen is that fear of childbirth can predict lower pain tolerance, longer labor, greater use of pain medicine in labor, and worse postpartum adjustment. Now, you might not be afraid of childbirth at all, and you might have a long labor. So you can't necessarily, you can't at all put people in a box in terms of what kind of labor they're going to have, and we can't control whether we're feeling afraid all the time, but we can control often how we relate to fear as it arises. And so what we've seen when we compare the blue line, which is Mind in Labor, which is an abbreviated version of MBCP, with a control group, is that there is much less pain catastrophizing among people who have taken Mind in Labor. And there is much more childbirth self-efficacy, the belief that you're up for this, for people who took Mind in Labor. And many less depression symptoms, which was sustained post-childbirth. And we have more recent studies that show depression symptoms still staying low 1 to 2 years later, and even in a 2022 study, 8 years later. So this is incredibly significant. I want to let you hear the voices of my patients at Family Health Center, because it's always best to hear from participants themselves rather than having me tell you how great MBCP is. So I'm going to stop sharing and share a different screen with some of my community health center patients in just a second. Please tell me if you can't hear the video. I've practiced this a few times and we could hear just fine, but I really want you to unmute and let me know if you can't hear it.
Classes are very useful for breathing, and it's very helpful for relaxing.
So when I was at the hospital with the contractions, I was just doing the breathing technique, which is the best thing that works for me.
So using the breath technique, I try to keep myself calm down, think if I can really solve this problem. If it's not, then just don't get too worried about it.
During the hospital, I could be more aware, more open. You open your mind because you have been taught to do it, to live that moment, to understand that this is life.
To manage my stress and my thoughts and the judgmental ideas, just to accept things like they are.
Not to judge yourself or judge others. Like, that's a constant struggle for me. But at least being able to be aware of those thoughts and catch them in the moment and just say it's just a thought and let it go and not hold on to
it. It was really helpful to not think about the pain all the time, but how to control and how to think about the way you think about the pain.
There are a lot of contractions in our life, not the labor. So
Like before, my mind was just like that. But when I had a class and then you keep saying, well, it happened, but just be in the moment. It has really been a helpful experience. I'm feeling like right now I keep telling people I'm like 70% better than I was before. Yeah, so it has really been a good experience, even for my anxiety.
Yeah, just helping me grow, and that has been the best preparation to be a new mom, and also helped me be more patient too. So it's like I always wanted things like, let's get it done yesterday, so realizing that it's going to take time.
So, though you might worry about it, but before I could worry for like a week, but now I'm like, okay, there's no point in worrying about it. I mean, if it is, it is, but if it's not, why worry about it? So
anxiety, it is still there, but I think I'm getting the hang of it, of how to control it.
Yeah. And being in this community with other people that are going through similar experiences, like it's really helps. And I still keep in touch with some of the people that we were in a group with. So it's good. I love it. I can't say like anything negative of the experience. It was so good. I would definitely do it again.
Let me share my screen again. Go back to the slides. Sometimes the present moment isn't an easy place to be. So we practice to learn how to be present with things as they are. So more research. And this was one of the very first research studies that was published, showed an increase in positive emotions and mindfulness. And again, a decrease in negative emotions, depressed mood, pregnancy, anxiety. This one you already saw in the graphs. And I already told you about the depression even 8 years later. This article was actually, the results of this research were also published in the New York Times because this was a randomized controlled trial with an active comparison group. Yes, Mind in Labor is like a weekend workshop. Probably enough to say about that for now, but it's online. It takes a few different formats because it can be hard to be online for an entire weekend. But yes, it's an abbreviated version that has some disadvantages compared to the 9-week class where participants get to practice in between each week. So this was a really significant study for MBCP. And the other research that has been done around the world has also shown higher levels of non-reactivity and self-compassion, two things that I think most parents need or could use more of. And then also showing an impact on infant social emotional development. And like we said earlier, maternal fetal attachment. So how does this work? How does this fit into eliminating health disparities? Why is MBCP something that we could look to reduce health disparities? One of the conceptual models that I like is from this conference, the Science of Eliminating Health Disparities conference. And I think of MBCP as a moderating factor. So in terms of outcomes, there are all kinds of things that influence outcomes, but MBCP, this class where people come together as a community, learn mindfulness skills for reducing stress and supporting being with fear and pain, can be a moderating factor in this model of what leads to certain outcomes. We have a colleague, Jane, who is on our faculty who taught MBCP for years up in rural Maine. And this is a quote that someone posted on her social media about being in labor, practicing mindfulness, approaching 8 centimeters. And perhaps what's even more significant, or just as significant, is her husband, while he was taking the MBCP class, decided that he wanted to write this letter apologizing for his driving under the influence. Obviously, every video, every picture, every letter is shared with patient permission. Here are some more quotes from patients at our health center about the impact of mindfulness practice. Oh, and actually, I'm going to go back. This quote on the bottom, often it gets edited to "I can't stop thinking," but actually it's supposed to be "I can stop thinking so much when beautiful things are happening." We also have centering pregnancy with mindfulness skills that exists and that we've done research on. We know in general that centering pregnancy decreases preterm birth. This slide is not about MBCP, it's just about centering pregnancy. And we know that centering is happening across the country. And so here's where we are in terms of our centering pregnancy with mindfulness skills clinical trial. And here are some quotes from participants in that trial. And from providers who were in that trial. So many ways to bring this back to work on Monday. And we probably won't go into all of them because I want to make sure we have enough time for a little bit of discussion and questions. But for example, knowing that multitasking is a myth. And I say work on Monday, but let me just say work tonight. If you're going to work tonight, home, parenting, not everybody goes to work on a Monday morning. There are lots of different definitions of work. So we can apply this starting right when you get off the Zoom call. Multitasking is a myth. Even if we feel like we're doing a million things at the same time, it's really just one thing, and then one thing, and then one thing. We and the parents that we take care of are potentially or actually really challenged by having little computers, our cell phones that we carry around in our pockets. And so how can we set limits for ourselves so that we don't feel like we're ruled by our technology? Can we really decide I'm just checking my email twice a day, for example? Some people set a little alarm to go off every hour, or here on this slide, it says every 20 minutes. And just take a breath in, a breath out, just be with one breath. We could talk a lot more about this. We could talk about this for another hour. But I think I should stop sharing my screen. And I should make sure that you know where to find more information and also introduce Dawn to you. So this is Dawn Nokomis, who's on your screen now. It says MBCP teacher training. Her name is Dawn and she's fantastic. Before we go into logistics of upcoming training and retreat opportunities, I wonder if people have questions, thoughts, anything else that's come up for you while we're doing pain practice or thinking about research.
I have a question. I've been looking into a lot of like the research on hypnobirthing. How does that overlap with MBCP?
So that's one of my favorite questions, actually. And one of the ways that I've heard Nancy answer it is hypnobirthing can be so helpful in labor for many people. And when your toddler is having a meltdown in CVS or a pharmacy on the floor when they're 2 or 3 years old, hypnobirthing won't necessarily help you anymore, but having a mindfulness practice might. And so the other difference that I see between this and hypnobirthing is, and I haven't had experience with hypnobirthing recently, so this might have changed, but we call pain pain. And in hypnobirthing, I think those words are changed slightly. I'm not sure if that's still the case, but yeah, I think I definitely, as a midwife, have seen hypnobirthing be very effective for many people. And in MBCP, one of our intentions is cultivating mindfulness that people can use in 10 years, in 20 years, throughout their lifetime, whenever a contraction arises. What else have people been thinking about during this presentation or wondering about? Or Carly and Jessica, is there anything you would want people to know about, and not to put you on the spot, zero pressure. I'm so glad you came to practice with us today. Is there anything you would want people to know about the teacher training?
I can just say that, you know, one of my favorite experiences ever going through the teacher training and the just, I mean, I guess I'll try to rein in my enthusiasm. But you know, if you're at all contemplating it, it was such a good choice for me personally that I have a hard time seeing how it could be a bad choice for anyone else. It was so fantastic, and I use, you know, the deepening of my own practice has impacted my life in myriad ways. And you know, I just saw that I didn't even really look too deeply into what we were going to do today, but I was like, Jen's offering a thing and I get to attend. I'm thrilled. I'm there. So I was, you know, I'm happy to, you know, I'd be happy to give my email if you want to connect or have questions. I'm happy to answer, speak directly to my own experience. And I'm just a huge fan. And I was thinking about the whiteboard exercise and the first time I taught it, and just what an incredible aha moment that was for the folks in the class. And getting the feedback form after I'd finished teaching. I've only taught one course now, but getting that feedback form and seeing what participating in the class had meant to those folks, like that was just completely priceless to me. So the time, the energy, the training, the practice invested, like it was all like, oh, this is, of course it's meant a lot to me, but seeing how it's mattered to other people and that impact is just tremendous. So yeah, thank you. And thank you a million times over to Jen and the whole foundation for continuing to teach and offer this and get this out in the world in a way that's, it matters to so many people.
Thank you so much.
And I second everything that you said. It is 100% worth it. I think, Jen, you were actually the one who said to me before we even started that it really is like a gift to yourself. And I really felt that, like, in this stage of life, having a 2-year-old and knowing that we were going to start to try to have a baby again soon. I thought I was a little crazy for doing it. But it really just helped me to prioritize my mindfulness practice and like kind of reconnect in that way. And then again, I'm not teaching yet just because, you know, there's other things happening, but I just really look forward to bringing it to people I already work with and people like within my community, because I've seen for myself the like personal successes that have come with it, and to be able to add it as kind of like a professional side of things too just feels so in line with a lot of my goals and values, and I felt really supported in that in the program also.
Thank you both so much for being here today. And I think there's a question in the chat about the training path. So the training pathway, the two offerings that we want to really accentuate right now are our fall training, which is fundamentals of MBCP, which is where you come in and you take the MBCP class with Nancy teaching it on video. It's a video from 1998, so long ago, but it has subtitles and the sound quality is good enough. And you take the MBCP class and follow along with the practices that the class is doing. And we meet 5 times during the fall to process how your training is going, how that MBCP class is going. Then in January, we move into level 1, which is training you to be able to lead the practices and do the teachings. It's very concrete and experiential and a lot of work. We meet weekly for 12 weeks. And then level 2, which is in the spring, is a little more theoretical. We take a step back. We learn about human development and how MBCP is related to Western psychological background, how it's related, or what the Buddhist history is behind mindfulness. We learn about trauma-informed mindfulness. We do a lot of work with EDI. So that's level 2, and it's 10 weeks after that happens after level 1. So the whole thing takes about 9 months. It's very possible that in the next month or so, we might be able to split up fundamentals or foundations of MBCP, not fundamentals, foundations from level 1 and level 2. We might be making that decision, but for now it's a 9-month training program. You can stop along the way and defer for another year, but often scholarships aren't guaranteed if you defer. So the scholarship opportunities that, again, we have a funder who is providing a lot of funding for the training this fall. That's available now. Even if you wanted to stay after and talk more about applying, Dawn and I are available to stay on. And then also the 5-day retreat from October 8th through the 12th is also enrolling now and has a lot of scholarship money available. So Dawn put the links. Oh, thank you, Carly, for putting your email in. Dawn put the links to enrolling in training here. I can share my screen for 1 second and just show you what it looks like. Okay, so you could also just click on the links yourself. I'm very old-fashioned, but so here's our retreat that's happening in Madison, Wisconsin. And again, funding available for people who are working with people impacted by health disparities, or if you're a member of a community that's impacted by health disparities. So this will be a much more immersive experience. And we do offer continuing education. And then if you go to professionals, you can learn more about our teacher training. Okay, and continuing education credits. Yes. We were figuring out, so if you do foundations and you haven't got, you can't get CEUs for the retreat and for the foundations course in the fall. But if you do the foundations course in the fall and you don't go to the retreat, you can get CEU credits for that. So maybe each person might put in the chat one thing that you want to remember from today, or one question that you have at the end of today. One thing you want to carry with you. Or one question you have. And thank you for choosing to spend your time this way today. It's a real investment in yourself and your own capacity to be with whatever arises as your life continues to unfold. Thank you, Carly. Thank you, Raya and Rachel. Thanks, Jessica. And may the work that we've done here today ripple out into our homes and communities further than we can see. Yeah, small moments. What would it be like if we just allowed ourselves to not rush for as many of the next moments of the weekend? One of my family mottos is Moffitts want the real deal. So of course there will be times you have to rush. We're human. And some of us are busy, and maybe we don't have to rush as much as we think we need to this weekend. Let's see. Thank you so much for being here. If you want, now you can close your eyes for one last mindful breath. This breath that's with us from the moment we're born until the moment we die. A trusted companion. When you're ready, opening the eyes if they've been closed, and unmuting to say goodbye if you'd like.
Thank you. Bye, everyone.
Being here.
Bye. Thank you so much.
You.
You.
Thank you.
Thank you.